press pause whilst you're reading the answers and then play again when you're ready to move on. So I've put this question, or in a way it's a teaching point really, about sepsis and this scoring system which has come in called qSOFA. SOFA is Sepsis Related Organ Failure Assessment. There's a few points to be made here. So let's have a look at this, these answers. So answer A, qSOFA includes CRP and hemoglobin. Now, it doesn't include those. There's no way you can know that, of course, if you don't know it, if you just don't know what qSOFA is. CRP, C-reactive protein, is a useful marker of inflammation. And of course, hemoglobin, as we know, it's the concentration of hemoglobin in the blood, is not directly related to sepsis. So question A is no. B, septic patients rarely need IV fluid. Well, that's not true. They're vasodilated, aren't they? And in fact, one of the sepsis 6, which we'll come to later, is give intravenous fluid. And in fact, if you meet a patient who's hypotensive, one of your first thoughts should be giving some fluid, of course with some caveats. So B is not true. C, septic patients are usually cold and vasoconstricted. Well, no, one of the primary problems in sepsis is vasodilatation, and the body's trying to compensate. The body would want to vasoconstrict, but it can't. So the only thing the body can do is raise the heart rate, raise the inotropic state of the heart. So no, septic patients are warm and vasodilated. That's part of the problem. So C is not true. D, qSOFA comprises blood pressure, respiratory rate and Glasgow Coma Scale. And these are in fact the 3 things that qSOFA comprises: blood pressure, respiratory rate and a measure of mentation, a measure of how your brain is doing. And I've put here Glasgow Coma Scale as a short point for that. So D so far is the most correct one. And then E, a qSOFA score of 3 means sepsis is excluded. No, that's the opposite. So the more qSOFA points you have, the more likely sepsis is. And we'll come to that later. So D is correct. The others are not correct. For those of you who aren't familiar, let's have a quick look at qSOFA score. So you get 1 point for altered mental status. And of course, Glasgow Coma Scale, as it goes from 15 to 14, anything less than 15 would indicate abnormal mental status. Number 2, a higher respiratory rate, more than 22, and a systolic blood pressure less than 11. So you have 1, 2, or 3 points for that, or 0, I suppose, you could say. Now, if you have 1 point, that might lead you to have a higher level of an awareness of sepsis. You might go and ask for that score to be done again. You might go and revisit the patient. Because, of course, as with all scoring systems, in fact, all diagnosis, there's rarely one test or scoring system that can totally exclude a diagnosis, and certainly can't exclude it happening in the future. And sepsis is something that can rapidly evolve. So this is the qSOFA score. And let's not forget that sepsis is proven or likely infection plus organ dysfunction. For those of you that don't know the Glasgow Coma Scale, it's out of 15 is the total, and you have a motor, a verbal and an eye component out of 6, 5 and 4 respectively, as on the graph. And you can see, of course, the higher score, the more conscious you are. The minimum will be 3 because you'll have 1 in each of those motor, verbal and eye. I've just put that in for completeness. We used to say that sepsis was SIRS, plus proven likely infection. Now, I've included that graph because it just shows you how inflammation can show itself in many ways. Of course, affecting the heart, the breathing, the fever response. You'll have a fever response or a hypothermic response. And then a blood response. The white cells may go up. We now think of SIRS as having many causes. So pancreatitis, a burn, transfusion, going on to cardiopulmonary bypass, or having any operation can cause SIRS. And that's one of the reasons why we've slightly gone away in medicine from using SIRS as a diagnosis, because so many patients had it. Doesn't mean to say it's not useful. It's a marker of systemic inflammation. But sepsis is now thought to be proven or likely infection plus organ dysfunction.